outcomes. Our case fatality rate is the lowest in the country. In addition, we have the highest testing rate per capita in the state and possibly in the country. What this testing allowed for was a successful summer of tourism and uptick of visitors. In addition, our second homeowners, which are typically with us in the winter, took up residency here with us for the duration of the summer. We protected the most vulnerable, in particular the nursing home and senior care facilities. We only had one death related to COVID in our senior care facilities. We also leveraged something called the MIRA bus, which is the Multi-Intercultural Resource Alliance bus, wherein we were able to, it's a mobile unit of sorts, and drive it into our Hispanic population. Chris mentioned earlier, it's approximately 30%, and we did about 3,500 tests or 100 tests in about 30 days. Next slide, please. So what were our factors contributing to the success? We're a 56-bed hospital. We're small enough. I think small enough to go fast enough definitely worked to our advantage. We had an all hands on deck present from the top on down. This was the #1 priority, and we were able to push other projects down and really focus on this. We had swift collaboration across disciplines and organizations, and I would really credit the model from the incident command. We most of those folks that were working in the incident command center also were part of this implementation. Our vendor worked tirelessly along with the Vail staff. So I don't know if you picked up from the timeline, but we actually implemented December 28th. So between Christmas and New Year's, which is one of the busiest times of the year for us. And I recall many hours spent on the phone designing, redesigning, troubleshooting, not only with our internal staff, but with the vendor, sometimes into nights, long nights. Susan mentioned we didn't let perfect get in the way of good enough. We did many cycles of rapid improvement, continuing to develop the software along with the vendor. In addition, I think we all are very familiar with healthcare is traditionally risk adverse. What we saw in particular with our primary care providers, they were resistant to putting the scheduling and then to follow registration into the hands of the patients. So I think changing that culture or having a proof of concept that then they could accept, and it was very much part of the patient experience that was so successful. And then lastly, project management structure. So project management is new to our organization. This was one of the programs, COVID testing, vaccination, and leveraging technology that we applied project management to. And it is a force multiplier, and we certainly benefited from that